My buddy's been bragging about the cars they've been dragging.
All right, just take a look. Huh? That doesn't look like a lot of the stuff that you see at the drugstore, right? Well, it's because of the fact that we have a guest who has been here now before. Introduce yourself to this crowd.
Hello, I am Dr. Ken Redcross.
And he comes in every once in a while.
Yes.
From New York City.
That's right.
Just to let people know in Arizona that they can be even healthier than they are.
Absolutely, and naturally on top of that, Pat.
Yeah.
That's the big key. Not all these pills that are being thrown everywhere.
No, and you're an MD.
I am.
See, a lot of times the MD folks don't really get into the natural medications as much as the folks who are DOs and chiropractors.
You're right. I kind of started on the dark side, Pat, until my eyes were opened, until I came out west and I was out in LA and I saw all these alternative ways of healing.
Let's talk about pain. I don't want to cause it. Let's relieve some of the pain. And let me ask you, if America leads the world when it comes to pain.
You know, it's funny, 120 million Americans each year spend over $300 billion a year in pills, pot, or procedures that quite frankly don't work. So everyone's looking for relief in all the wrong places. So for me, I said, you know what, let's do three things. Let's try to deal with pain either with our diet, with relief remedies that are closer to the earth, or then let's do something to change our lifestyles. So that's what we should do with some of the things that people come to see me in the office for.
Well, okay, I'll tell you what, you came to see us.
That's right.
And you came to see them. So let's take a look at some of the alternatives that we're talking about over here.
So what we have here is that a lot of patients come in from muscle pain. Now, muscle pains come from overuse and a lot of things that we do in just our everyday lives. So one of the things I love here is turmeric. Turmeric is a regular anti-inflammatory, and it's been around in Indian cuisine for thousands of years. So it's something that we all have potentially in our cupboards, which doesn't require a prescription pad from doctors who are out there. The other thing you'll see here is a beautiful assortment of nuts. I am totally nuts about nuts because they're so healthy for us. So we have pumpkin seeds, cashews, almonds, flaxseed oil. Those things are all important because of magnesium. Magnesium is quite beneficial for our muscles as well. So that's why that's so helpful to bring in.
But you can't just all of a sudden walk into the health store or the drugstore and just say, oh, listen, the doctor said I'm going to take magnesium, and then do it, right?
No.
You should know what you're doing.
You absolutely should. You can't do that. But the good thing is that a lot of these foods, they already have them in there, so they're natural. Once again, that's the important part. As we move to other ways to even treat muscle pain here, we have Arnica montana. It's a homeopathic remedy, also known as the mountain daisy, hence these gorgeous daisies here. And that's to remind everyone out there that it's important to try to stay closer to the earth. It's a homeopathic remedy, so the thing that's key is that it is absolutely safe. And not only that, it comes in two wonderful formulations. You can get them here in the pellet forms, which is great if you have generalized pain, and you can also get it in a cream or a gel. The big thing there, Pat, is that it doesn't have that medicine-y smell as some of the other over-the-counter remedies that help for muscle pain.
Arnica montana sounds like a quarterback or a Disney comedy character.
And it works as well as that quarterback did as well. So I think that's why I love always telling people about it when you're thinking of natural ways. The other thing, it also helps with bruising and swelling, which is why you'll see a lot of my plastic surgery colleagues, even though I know there's no plastic surgery here in Phoenix or Scottsdale, but just in case there were, it's actually beneficial for bruising afterwards. So it's really good for that as well.
I was 6'3" before I started doing plastic surgery. Okay, and over here?
Over here, we actually have a couple of things that are important when we talk about joint pains. Now, the key is when we talk about joint pains, we're not talking about adding food substances. We're talking about avoiding certain things like refined foods, sodas. I wish I had a soda can here so I could crush it up so I could let everyone know how horrible it is. Also, fried foods aren't good, so you want to avoid those things. But for relief remedies, you have something like glucosamine, which is wonderful, which brings cartilage back to our joints. We also have vitamin D because there's some studies that show if your vitamin D is low, it may actually predispose to pain as well. So something to think about. Now, when we talk about lifestyle changes here with joint pain, one of the great things that you can do is exercise. Obviously, exercise ends up helping with weight loss. So 1 pound of weight loss equates to about 4 pounds on your joints. So it's huge. And last, you know, I'm a very spiritual guy. So one of the things I saw that made me even more excited is that Tai Chi is actually beneficial. So Tai Chi can also help with joint pain
Well,
as well.
remind everybody what Tai Chi is, because if you've been fortunate enough to go to Asia or be in any areas of American cities that have Asian neighborhoods, you'll see that exercise being done, and it's beautiful to watch.
That's exactly what I was going to say, Pat. It's a beautiful thing to actually see in motion as far as the movements and the spirituality that goes with it. So in just talking about some of these things, we've talked about things that are in our cupboard. We've talked about arnica montana, which is a cream or a gel or even pellets. And we've also mentioned glucosamine and these things that are all natural. I didn't even mention that we also have Epsom salts, which are also good for muscle pain. So who doesn't like a nice warm bath, right?
Yeah, no, that sounds terrific. As a matter of fact, I've been trying to get them to do that for the staff right here, starting with me. Epsom salts in a warm bath, terrific and soothing.
Exactly.
But we don't have all of these things automatically at the ready, and we don't necessarily have an Indian restaurant in every neighborhood.
Right.
What do we do with the most common pain, headaches?
Okay, so when you talk about headaches, we have some wonderful things. Keep in mind, headaches can be very, very horrible all the way around. It can lead to disability, lost work days, those things. So there are some things such as feverfew. Feverfew is a wonderful herb that's been shown to be very beneficial for headaches.
How
and
do you
much
spell
like
that?
F-E-R, like a fever and then few.
Okay.
F-E-W. The other
Okay.
thing that's interesting too, just like arnica montana, it's from the daisy family as well. So it's interesting. So everything's coming up daisies here today. But I'll tell you this, the other thing you could do are peppermint oil and basil oils, and they're actually applied right to the temples at the time that you're also having the headaches. As far as other things we need to talk about, you have to talk about stress. Because stress leads to a lot of headaches, just like it can for muscle pain and joint pain, so we all have to figure out a way to manage that. Once again, you could do that spiritually as far as with meditation, yoga, some of those things are quite beneficial. So
And there's
headaches
Tai
are something.
Chi classes, by the way, that are available in a number of areas around here. All you have to do is to check online. And what about those concierge doctors? He is one, and before you leave, you got 15 seconds to tell everybody what's the difference between a concierge doctor and the rest of the folks.
It puts the importance where it belongs, and that's on you and everyone out there. That's where it all really should be focused upon. So once again, your doctor should feel like a member of your family, and when you get a concierge physician, you have a new member for life.
What a shock, what a surprise when you walk into your family physician and say, I'm here from my Arnica, Montana. This is Pat McMahon. You heard about it all on AZTV.